Assalamu alaikum guys, welcome back to Akshay Pharmacist Mariam YouTube channel. Today we'll be discussing a very hot topic, respiratory syncytial virus that causes bronchiolitis. So without any delay, let's start today's lecture. But before starting this lecture, I would request you to kindly subscribe to my channel Akshay Pharmacist Mariam. And if you have any query regarding this lecture, you can ask in the comment section and share this video as much as you can in your circle. So respiratory syncytial virus or RSV is a common respiratory virus that usually causes like mild cold-like symptoms. Most of the people recover in a week or two, but RSV can be serious, especially for infants and older patients. And RSV is the most common cause of bronchiolitis, inflammation of the small airways in the lungs. And it also causes pneumonia infection of the lungs in children and younger children than 1 year of the age. And it is the major cause of that. Respiratory syncytial virus causes infection of the lungs and respiratory tract. It is very common in the children and in the adults. There are a lot of self-care measures that should be taken to relieve its discomfort state. As defined here, respiratory syncytial virus, also known as human respiratory syncytial virus and human orthoimmunovirus, is a common contagious virus which it transfers from one person to another person that causes infection of the respiratory tract. It is a negative sense stranded RNA. If we study about the profile of the RSV virus, so its class is Mongi varicitis, family is Nomino-Viridae, kingdom is Orthovirae, and order is Mononegi, Mononiga virals, and the phylums and the species is as given, and it is unranked in any classification and it is marked as a virus. So now we will study about the symptoms and the care that should be taken. The most common symptoms of the sign and symptoms of the respiratory syncytial virus infection appear about like 4 to 6 days after exposure of the virus. In adults and the older children, RSV usually causes like mild cold-like signs and symptoms. These include congested or runny nose and dry cough, low-grade fever, sore throat, sneezing, and headache. In severe cases, it can also cause inflammation of the airways in the lungs, that is pneumonia, and also infection in the lower respiratory tract, bronchiolitis. It can cause fever in that case, severe cough, wheezing, mean if you exhale, there's a high pitched noise that's called wheezing, and rapid breathing or difficulty in the breathing if the person is sit up rather than lie down, and bluish of the skin when your skin start getting a blue color because of the cyanosis or lack of oxygen. In the infant, it mostly causes a short and shallow rapid breathing, a struggle to breathing when chest muscles and skin muscles pull inward with each other. It can cause cough, poor feeding, tiredness, and irritability. Most of the children and adults recover from it within like 1 or 2 weeks, and some might be repeating like wheezing, and they might need some time to get properly treated with this condition. If we now talk about the symptoms that are mostly appeared in like 4 to 6 days, it is runny nose, decrease in the appetite, cough, sneezing, fever, and the wheezing. And the care you have to take, call your healthcare professional if you or your children is having difficulty in the breathing, not drinking enough fluid, and exercise, experiencing a worsening of the symptoms. And the care include like most of the RSV infections go away on their own within a like week or two, and if there is still difficulty in the specific treatment, there is no specific treatment for RSV infection, though researchers are working to develop a vaccine and antivirus medicines that fight the viruses. So, you should have to take some steps to relieve the symptoms of the. So, first of all, fever. Manage fever and the pain with like aspirin in the children, should not be given to the children aspirin because it can cause complications, and you can use any safer answer in the children for relieving the pain like Panadol, and drink enough fluid, because if you are not drinking enough fluids, you can get at state of dehydration, and talk to your healthcare provider for the specific ingredient of the treatment. And if RSV can cause more severe condition, in that case, the person might get into IV fluids, and he might get hospitalized. And if he has higher trouble in the breathing, he might get uh, tube inserted in his mouth, the airway, that is intubation. So that was the symptoms and the care for the uh, this treatment. And complications in the there are risk factors that are related to the RSV. So let's study about the complicated state, or the first we will discuss about the high risk of the risk factor of the RSV. So the RSV, most of the people who get RSV infection will have mild illness and will recover in a week or two. Some people might develop severe RSV infection and might need hospitalization, and they might get bronchiolitis and pneumonia. So RSV can make them a chronic health problem person. For example, if the person with asthma, he can get a recurrent asthma attack. In that case, the patient might get congestive heart failure and may experience severe symptoms triggered by RSV. So the following people might get severe complication in that their state, and in the children, they might be how to product love one, and in the older we know how to manage them. And then we will discuss about the complications that can include in the. So I as I've told you before that RSV can get complications in the patient, who are having hospitalized a severe RSV infection in the hospital. They might be getting treated with the breathing, artificial breathing, and IV fluid. In the case of dehydration, if the patient is getting pneumonia like bronchiolitis and the pneumonia, the patient would be treated with that condition. He would get the medication for the pneumonia and the bronchiolitis, anti-inflammatory. And if it might get a complication of the middle ear infection. If the germ enter into the eardrum, it can cause otitis media, middle ear infection. If the patient is having asthma, then it can cause a worsening of the symptom of the asthma, and the patient might get repeated infection. And these were the complications. Now we will study about the risk factor. Who are the patient who are the risk of developing this RSV? So the risk factor in the infants, if the infant is premature infant, and he is either 6 months younger or even younger than that. If that infant get RSV, they would be at risk. And if the patient is already having any chronic lung disease, or he might have any heart disease, and they are also at the risk. And the patient or the children have neuromuscular disorder like muscular dystrophy, and the adult who have heart failure or lung disease, or in the adults who are have the age of 65 years or the older, they are also at the risk of getting RSV and that state. Then we will discuss about the infant and the children, how we have to deal infant and children for that condition. As I have told already that the child who are premature or have the age of 6 months or younger, or the children having chronic lung disease, or they have weakened immune system, or the children have neuromuscular disorder, they are the risk of developing that condition, and they might get severe infections like bronchiolitis and pneumonia that can be health hazard from them. And the RSV in the very young children can cause irritability, decrease in their activity, decrease in their appetite, or even get cause apnea, mean they're having pauses in the breathing more than 10 seconds. And to prevent that state, and to prevent the transmission of that RSV, you have to like wash your hand wash your hand often with the soap and the water, with like for at least 20 seconds. And you can use alcohol based sanitizers, washing your hand with uh, to protect germs, and keep your hand off your face. Avoid touching your eyes, nose, the mouth with the unwashed hand, and germs spread this way. And avoid close contact with the sick patients who already have cough, cold-like symptoms. Avoid getting in contact with that patients, and avoid close contact with the sick people, and cover your cough and sneeze with your tissue, or with your upper shirt sleeve, or uh, with your arm, and clean and disinfect the surfaces that are like frequently touching. Surfaces should be sanitized and disinfect, like your mobile phones, toys, and the doorknobs, and that are frequently used, that should be cleaned and disinfect. And stay home when you are sick, because you can spread your disease to other. And scientists are also working on developing the vaccines. So till that, till that you can use palivizumab for as a medicine for that RSV. That is the disease. That is the medicine that is most effective for that. But for the prevention, you have to hand your and you have to wash your hand, avoid exposure, and keep things clean and disinfect. Don't share your drinking glasses to other because it can spread it. And don't smoke, because if you are already smoking and you are getting RSV, the complications would be more. And wash your toys regularly. The protective medications can be for the children who are prematurely born, or have the chronic lung disease, or have certain heart disease, or they have weakened immune system. For that, preventive medicine can also be taken, or even in that case, if the vaccination is available, they can get the vaccination for that. Then comes the take steps to relieve the symptoms of RSV. But before that, I will tell you about the productive medication. Medication like palivizumab, given in the form of short of injection, can protect certain infants and the children of 2 years age old or younger, who at the risk of developing high serious or serious complication from the RSV. They might get palivizumab. And high risk children of the age group who are either prematurely born, have lung disease, or have chronic lung disease, or have certain heart disease and have the weakened immune system, they will get the first injection in the given the start of the RSV season, with monthly injection given during the season. The medication only helps prevent RSV infection. It does not help to treat treat the symptoms once is developed. Talk with your child doctor to find out if your child would benefit from the medication, and to learn more about it. The complication is not recommended for the healthy children or for adults. Scientists are also continuously working to develop the vaccine for the RSV, just like the COVID. But there's certain difference between the COVID and the uh, state of the RSV infection. And if you get the infection, then certain steps should be taken to treat the like signs and symptoms of the RSV infection, and to relieve the sign and symptoms of that condition. There should be certain medication and the treatment, like drink plenty of the water, take any antiviral, and they take fever and for the fever anti pyrogens, NSAIDs, and to relieve the pain. And you can take a nasal decongestant to avoid the symptoms and sign of the infection. So these were the symptomatic treatment for the RSV infection. Then we will discuss about uh, the RSV can cause more serious health problem. As I have told you before, people who have the risk can develop high state of the infection with that. So that kind of the patient should be with uh, very uh, transmission should be uh, protected in them. The clinical description and diagnosis, how we will diagnose the RSV infection. RSV infection can cause a variety of the respiratory illness in the infant and the young children. In most commonly causes, it's like causes a flu-like or cold-like illness, but can also cause a lower respiratory tract infection, bronchiolitis, and pneumonia. And 1 to 2% of the children of under the 6 month of the age with RSV infection may need hospitalization. And the severe disease most commonly occurs in the younger children and infant, like they are either premature or like the condition I have already described. So most otherwise healthy infants and the young children who are infected with the RSV might get like intubation and the mechanical and the non-mechanical ventilation and improve their supportive care and the discharge. In the children, in the older adults with the chronic medical condition, adult who are infected with the RSV have mild or no symptoms. Symptoms, we diagnose it with the symptoms. Symptoms are usually consistent with upper respiratory tract, which include rhinorrhea, uh, pharyngitis, cough, headache, fatigue, fever, and the disease usually long for the 5 days. And some adults, however, may not have more severe symptoms, consistent with the lower respiratory tract infection, who are the risk of developing severe RSV illness. They might be elder than 65 years of the age, or might they have any lung or heart disease comorbidity, or might they have a weakened immune system, or have asthma or COPD or congestive heart failure. As far as concerned with the clinical lab testing, Uh, clinical symptoms of the RSV are non-specific and are overlapped with other viral respiratory infections as well as some bacterial infections. Severe types of the lab test available for confirming RSV infection. This test may be performed on upper and lower respiratory specimen. The most commonly used type of the RSV clinical lab test include real-time reverse transcription polymerase chain reaction, RT-PCR. So you have to done the PCR, which is more sensitive than culture antigen test. And the second is antigen testing, which is highly sensitive in the children but not sensitive in the adults. And less commonly, we also use uh, viral culture, or we can do serology, which is usually only used for research and surveillance studies. Some tests are differentiated like RSV subtypes A and B, can also differentiate between what are the type and subtype of the RSV infection, and but the clinical significance of the subtype is unclear. Both have like same conditions, and for the children and the young adolescents, same PCR and the culture sensitivity test would be done, and either we can detect the virus isolation antigen method can also be used in the children, and the prophylaxis and the high risk infant is also very important. So I have told you before, palivizumab is a monoclonal antibody recombinant by the American Academy of the Pediatrics to administer to high-risk infant and young children likely to benefit from immunoprophylaxis based on the gestational age and certain underlying medicational condition. It is given in monthly intramuscular injection during the RSV season, which generally start in the fall and the peak of the winter, mostly in the United States. And for the palivizumab guidance, you can visit the APP policy statement, and there is a technical report also available for this. And because they are at the high risk, so there is also certain uh, fight between the RSV and the COVID. Means the symptoms and signs are mostly very same, but there is certain differentiation between the RSV and the COVID-19. So at the end of the lecture, I will tell you what is the difference between the RSV and the COVID-19 and what are the similarities between them. Both are caused by the virus, because RSV and the coronavirus disease 2019 COVID-19 are both type of respiratory viruses. Sometimes the symptoms of the RSV and the COVID-19 can be similar in children, or symptoms of RSV and the COVID-19 can be similar, and in the children, COVID-19 often result in the mild symptoms, such as severe fever and runny nose and cough. And for the adults, COVID-19 symptoms may be severe and may include trouble in the breathing. I mean, there are the difference. There is the difference of the serology, and there is also a difference of the symptoms of the infection. Having RSV may have a lower immunity and increase the risk of getting COVID-19 for kids and adults. I mean, if they have a lower immunity, they can get COVID and RSV at the same time also. And they are uh, and these infections may occur together, which are worsens the severity of the COVID-19 illness. In some, if you have symptoms of respiratory illness and you have a doctor, you have to visit to your doctor and seek immediate medical attention if your children or anyone at the risk of severe RSV infection, having breathing in the difficulty, having high fever, or having a blue color of the skin, particularly in the lips and the nails bed. So you have to visit your doctor as soon as possible because this is a really complicated state of having RSV infection. So I hope this lecture would be quite informative for you. If you have any query regarding the RSV infection and the bronchiolitis and pneumonia condition, or have any query about the treatment and the guidance about the treatment of the RSV infection, you can ask me in the comment section. Thank you so much for supporting me and subscribing to my channel and helping me to grow helping me to grow my channel. Thank you so much. Kindly subscribe to my channel, Akshay Pharmacist Mariam, and share this video to your community and like this video. Thank you so much. Goodbye. Allah Hafiz.